It's important that if you're experiencing a mental health crisis, it's not criminalized, right? You're not handcuffed and put in the back of a car, or you're not handcuffed and put in an ambulance. We've all seen the videos of what happens when someone is experiencing a mental health crisis and you call the law enforcement.
I mean, 911 has just been around forever, so it's just a catch-all number. But the downside of that is that there are specific situations that don't require a certain type of a response. And a mental health crisis, somebody who is feeling suicidal and maybe aggressive because of that, their response shouldn't have to be a police officer. People that have had these mental health crises in the past, if 911 was the only number, people have just decided not to call. It's been a need for years. And so now instead of 911 being called and police officers responding, then 988 is called and people that understand the work can be there instead.
So when you do the kind of work that we do, we're used to managing crises. Doing that and understanding it and having the capacity to have better outcomes, it's what we do. And we've always been committed to working with kids and families who have the greatest needs. So when the opportunity came up with Los Angeles County to be the provider of mobile crisis response for anyone who calls 988, we jumped at it.
The idea is that if there's a mental health crisis, somebody can call 988, get the help they need, and get directed to MCOT teams if they need physical contact to go out and assess and to make sure that they're okay.
Sometimes when we get the call and we have the conversation and we get to the home, the person they're calling about has left because they're afraid that the police might show up, because they're not used to having someone else show up. When someone sees you and they're in a crisis, they want to feel safe. And they oftentimes don't feel safe with law enforcement.
And everyone's heightened, everyone's scared. There's just a lot of delicate, intricate, complex assessing that goes on in all of those visits. And there has to be a lot of care and warmth and compassion for the situation that's taking place. I think that 988 is a way to gain back the trust of society, that when you call 988 for a mental health crisis, that you are going to get the response that you deserve and that you need. If you earn the trust of society, you end up saving lives.